Good morning from WKYT News. I'm Bill Bryant, and we welcome you to Kentucky Newsmakers. Later, an update from the head of the Foundation for a Healthy Kentucky, former Attorney General and former Congressman Ben Chandler, will be with us later. But first, the Kentucky Senate Majority Leader Damon Thayer is here, just as he's getting ready to sit down and try to iron out differences with the House over the state budget. The House version of the budget raises revenue with a tax hike on cigarettes and a new tax on opioids. That money would let the House budget restore cuts of more than 6%, including for state universities. EKU is the latest public university to say that deep cuts are under consideration there. The Senate version of the budget does not call for more revenue. It does make some cuts while moving money around to soften the impact on primary and secondary education. Majority Leader Thayer is the Republican leader there. He is busy in the upper chamber as time is ticking, and we're glad you could make time for us. And I guess you had to take it out of sleep if you stayed up for some of the games. We're taping this on Friday. Thanks for being here.
Great to be here, Bill. Thanks for the invitation.
So you now sit down. You will be going through a process that I'm sure is very detailed in trying to reconcile two different spending plans, one presented by the House, one presented by the Senate. Who will be in that room? How do you come together? How does this process work for those out there watching?
It's called a conference committee. Actually, technically, it's a free conference committee.
And what is that? What does free conference mean?
A conference committee means you have to be very specific in the changes you make. A free conference committee is basically that. It's technically a free-for-all.
It's on.
It's on. Where changes can be made as long as we all, in a majority vote, agree on them. And it includes the two budget committee chairmen, Stephen Rudy, Representative Rudy's from Paducah, Senator McDaniel from Northern Kentucky. They chair the respective budget committees in the House and the Senate, and all of the members of leadership, Democrat and Republican, from the House and the Senate, and potential, like we added our vice chairman, Senator David Givens from Greensburg. So it's a group of people who have a great deal of familiarity with the budget process. We get in a room, we have a big, thick document, couple hundred pages. It's called a differences document. It has what the governor recommended, what the House recommended, what the Senate recommended, and we go through it. And where we find agreement, we move on, and when we don't, we pin it and come back to it later.
There are two very stark differences in that the House raises revenue and softens the cuts, and the Senate leaves the cuts in place and does not raise revenue. How do you reconcile that?
Well, to be more specific, the Senate budget does not raise taxes, and that was a consistent position that our caucus...
No revenue in any way.
Correct. Yeah. That's correct. Well, generally, the only way to get revenue is through tax increases.
Well, there have many suggestions been made, of course, for alternatives.
Sure, but we don't have the votes for those things. Marijuana, expanded gambling, et cetera. We don't have the votes. So we have to sit down and go through that document page by page and item by item. It's a $22 billion spending document that would go into effect on July 1 for the next biennium.
You would take it that the House tried to find easy targets in cigarettes and then this tax on opioids. You have said that both are bad policy because they are designed to go away. Is that your chief objection?
Well, the opioid tax is very questionable as to whether it's even legal, and I question the fairness of taxing the legal use of opioids for painkillers, cancer patients, people in hospice. I mean, you'd be passing that cost on to them. We'd be the first state in the country to do something like that. And a cigarette tax is a declining source of revenue, and you know, the folks who are calling for a cigarette tax for the purpose of behavior modification make a good point, because if you tax something more, the use of it is going to decrease. And so that then makes the case for really not trying to base future revenues on it, because it's a declining source of revenue. Look, I think there is support for a cigarette tax increase as part of comprehensive tax reform. I'd be willing to consider it if we could look at getting down the rates on the personal income tax and the corporate income tax, moving away from taxing production and moving more towards taxing consumption, like states like Tennessee and Texas and Florida do, even Indiana. They have a lower personal income tax rate and a more broad-based sales tax. But these things need to be considered as part of comprehensive tax reform,
well, Mr.
which
Lear,
I think we'll get to at some point.
How have all these other states gotten to it? We have talked about this for 20 years in this state. The legislature never gets there. The House Budget Chairman, as you said, Steve Rudy, has called it a failure because the legislature this session didn't get there. Kentuckians look out, they see a strong national economy, they see other states doing well, and they wonder why we have such flat revenue.
It's a very valid point, and it's very difficult to do because in tax reform, someone's ox is going to get gored. And so those interest groups and individuals who feel like their taxes may be going up are already, frankly, they started it last year, lobbying the legislature, don't tax you, don't tax me, tax the man behind the tree. And that's the balance you have to try to get when you do tax reform. What's fair, what more accurately reflects a 21st century economy. And I'd like to get something that doesn't raise taxes on the first day it goes into effect, but creates a more business-friendly environment so we can continue to grow jobs, create more taxpayers, and that naturally brings more revenue into the coffers.
But again, and I've been both places covering the legislature and seeing it as a citizen, and you certainly serve there and know what it takes to move legislation. You talk about those obstacles in the way. But for Kentuckians out here who watch hours and hours of people being introduced on the floors of the chambers and this kind of thing, they wonder about this, why is there no time to get this done, which is what so often comes up.
It's not a matter of time. It's a matter of will and courage, and people who are willing to look beyond the next election and look to the next generation. And I also think it's something that we need to hear from our constituents. And I don't know that Kentuckians really understand how bad our budget situation is in Frankfort, and it's driven by rising pension costs. This year, we're going to appropriate $3.3 billion to public employee pensions. That's nearly 15% of the budget. 10 years ago, pensions were 7% of the budget. And I don't think people quite understand how significant the problem is and how much we need reform in pensions to help bring budget relief, and also that we're going to have to continue to make these multi-billion-dollar investments. And so if we could get to a tax code that more accurately reflects our modern economy and grows revenue as a result, that would be, because look, the pension problem and the budget problem are intertwined, and we're going to have to continue to put more and more money into pensions for the next 20 years. It's just a fact.
The public universities are going into a second decade of cuts. This started when the recession hit so hard back in 2008. EKU is talking about now cutting 200 jobs, eliminating programs, potentially closing an extended campus. Western has done significant layoffs. Morehead State downsizing. UK only getting a small percentage of its budget now from the state. Evidence generally shows that those with college degrees make more money and pay more taxes. Is it smart to be cutting the universities?
Well, they get $1 billion a year from the taxpayers to forward their mission. And I'm extremely sympathetic, especially to our regional universities. My son goes to NKU, so I'm a tuition-paying parent. I help him with his tuition there. So I get it. And again, it just goes back. Pension funding and the increase in Medicaid because of the Steve Beshear implemented Obamacare continue to crowd out everything else in the budget. And when you don't have revenue growth that's significant enough to meet these needs, you're forced to cut. And where do you cut? You cut where 50% of the money goes to, and that's education.
The governor said that people opposing the pension reform are hurting the state. Do you agree with that, and do you feel at this point that Senate Bill 1, the pension proposal, is dead for this session? I'm
not willing to declare it dead, but I'm not very optimistic that we're going to get something passed. We still have some time, and there are ways that we could move something forward, either Senate Bill 1 or something like it. But it's going to take, quite frankly, members of the legislative bodies, the House and the Senate, to tell their leadership that we're willing to take a courageous vote and stand up and do what is right for the next generation and make these structural changes that are embedded in Senate Bill 1.
I know you also said that there is a linkage to another Senate bill that would soften at least the impact to state and local, to the local governments that may also get a big bill for pensions coming up. Do you pass that without passing Senate Bill 1?
Pretty unlikely. The two are intertwined. The Senate Bill 66 would allow a phase-in of the increased pension contribution for those in the CERS plan. School boards, cities, counties, and even the state, we have employees in CERS. But if you phase in that contribution and give them a break on going to the full 100% contribution, and you don't get the level dollar funding required in Senate Bill 1, you blow a huge hole in the unfunded liability of over $1 billion. So I understand and am very sympathetic and hope we can come up with a solution for the CERS participants, but we also have to be very cognizant of our already $65 billion unfunded liability.
Because again, the mayors and the county judge executives and so forth are talking about if they get hit with those full bills, they will have to make cuts in services.
Tough decisions are looming at all levels of government, and it would very much help all levels of government if we could pass some structural pension reforms, in addition to the extra funding we're putting in this year.
You've introduced a bill that would have exempted the use of private phones or laptops from public sunshine laws. What do you think should be exempt from the law when public officials are doing the public's business?
Well, it's a bill that would simply codify an Attorney General's opinion that was proffered by Jack Conway when he was Attorney General over 2 years ago. It has not been questioned in the courts, and we think that it needs to be codified into law just to bring some clarity to the situation. We have a citizen legislature. We all have private communications, private businesses, and I think those should be exempt from the open records law. I don't think that communications on public email, publicly funded forms of electronic communications should be protected. But those that are private, related to private business, private personal communications, they should be protected. Otherwise, it could have a chilling effect on the ability of both parties to find good people to run for the legislature in what is increasingly becoming a full-time job, even though it is by definition a part-time citizen legislature.
But you would be able to talk about public matters on a private phone and get around to the scrutiny, right?
I mean, how else are you going to do the job, Bill?
Well, it'll be interesting. We'll see where this.
We're working with the Kentucky Press Association.
Did you pull that back, though? I mean, it was.
It's on the orders of the day, okay. But we passed over it. We're going to work with the Kentucky Press Association to try to tighten down the language. But this could have a chilling effect on both parties' ability to find good people who are willing to do a very difficult job.
A few seconds left. The legislature is set to go home on April 13th, unless you can tell us something about the calendar being switched around some. Do you think that this will go down as a successful session?
If we can pass a budget and a road plan, I think it will be successful. And there are a number of other bills that have been passed that we will be reviewing and talking about as successes. I really hope we can get something done on pensions. I said at the beginning of the year, if we could get pensions, a road plan, and a state budget passed, it would be a successful session. I hope I'm not quoting that great Meatloaf song, 2 out of 3 ain't bad. I'd prefer that we go 3 for 3.
You've been there a long time. Are you frustrated here as the session is wrapping up?
Very frustrated. Yes, I've been there 15 years, been working on pension reforms for 11 years. The Senate called for changes in pensions 11 years ago. We've made some steps, but we need to do more because the result, if we don't make further changes, is calamitous.
Senate Majority Leader Damon Thayer, thanks for coming.
Thanks for having me, Bill.
Ben Chandler from Healthy Kentucky Foundation will be joining us next on WKYT's Kentucky Newsmakers. Welcome back to WKYT's Kentucky Newsmakers. One of Kentucky's biggest challenges is poor health. Our cancer, heart disease, and diabetes rates are at or near the top in the nation. The Foundation for a Healthy Kentucky looks for and advocates for solutions that might improve those numbers. The foundation has pushed for a major increase in Kentucky's cigarette tax in this legislative session. Ben Chandler runs the Foundation for a Healthy Kentucky. He's a former Kentucky State Auditor, Attorney General, and Congressman, and he joins us on Newsmakers. Good to see you. Thanks for coming back.
Always excellent to be with you, Bill.
When you took the job of trying to improve the health of Kentuckians, did you really know how profound the challenges out there are?
I had a decent notion of it, yeah. I mean it's there's no shortage of things to do, I can tell you that. We have very poor ratings in almost every health indicator that you can think of. But it didn't surprise me really at all. I've been familiar with the health situation here in Kentucky for a long time, and we've got a lot of work to do. The fact that we lead the nation in cancer, that's the thing that jumps right out at you. It's intolerable in my judgment. I don't know how good thinking citizens of goodwill can let that situation go on. And what's interesting about it is that it's a lot of it's preventable. A full third of cancers are attributable to smoking. That means that a third of the cancers are preventable. So let's do what we can to prevent it. That's my view.
So that's what you're out working on right now. The smoking rate remains high in Kentucky. A coalition of health groups, including yours, proposing a tax increase on cigarettes. Now, the House, in the budget that's been proposed, is going for a 50% hike. The Senate does not put that in its budget, and they're trying to reconcile all of that this weekend. But some of the Senate, they've said no, because they say a tax hike on cigarettes is a tax that's designed to go away.
We hope it does go away. That means that fewer and fewer people are smoking. This is a health policy. This tax on cigarettes is primarily a health policy, not a tax policy. The whole reason for it is to try to discourage smoking. You get the price up high enough and people will quit, and particularly young people won't start. Young people are particularly sensitive to the price. And that's what we want to do. We want to focus on keeping young people from starting in the first place. And the dramatic effect that this has on so many things in Kentucky is really unbelievable. We've got, as I said, we lead the country in cancer. That's attributable to us also leading the country in smoking. But that's not all. We've got emphysema rates that are high. We've got COPD rates that are high. We've got heart disease rates that are high. And that also is not all.
You have said that when businesses look to somewhere to locate, that this poor health in Kentucky is one thing that is against us.
You can ask David Adkison at the Kentucky Chamber of Commerce, and they are a very important member of this coalition. We've got about 160 groups in this coalition. But David Adkison and the Chamber will tell you right now that businesses want a healthy workforce. It's extremely important, and the reason for that is simple. It costs them a lot of money to have unhealthy workers. It costs them on the front end in terms of low productivity, and it costs them on the back end in terms of higher health care costs. So a business clearly is not going to locate in a place where you've got health problems. So we got to get a handle on this. This is really, really important.
Do you think Kentucky still has difficulty in taxing tobacco based on history?
Well, sure. We have a deep heritage, a deep tobacco heritage. My own family was involved in a big way in tobacco. Probably my education was paid for to a large extent by tobacco. But when you see the cost to the society at large, you really feel like you have to do something about it. One of the things I can tell you, though, is we grow a whole lot less tobacco than we used to. In 1992, we had 60,000 tobacco farms here in Kentucky. And that represents at least 60,000 families that have been involved in the growing of tobacco. That number has dwindled now to fewer than 4,500. So that gives you an example of just how much it's changed.
What are you trying to get people to do right now who support this cause?
Well, we hope that everybody will call their legislator and let them know that this is extremely important. It's important for them to call their legislators right now and tell them that they believe that a tax hike on tobacco products will be an important and healthful thing for this state. There just isn't any question about it. And the good news is this other thing of interest: 70% of the people support this. This is well supported. Polling regularly shows that it's supported by a large majority of the people here in Kentucky.
Polling also indicates, Mr. Chandler, that Kentuckians support indoor smoke-free environments, and yet there is no indoor smoking law in
Well,
Kentucky.
we want that too. Now, we're not pushing that in this session, but we're actually very interested in getting smoke-free laws passed in communities throughout the state. The legislature has signaled that they don't want to go there right now for a statewide law. We wish they would, but they've said they're not going to. So this same coalition of 160 groups is going to try to get smoke-free laws passed on the local level in counties throughout the state. Right now, we have only 4 counties out of 120 that have comprehensive smoke-free laws. Now, there are a lot of other cities and jurisdictions that have smoke-free laws, but only 4 full counties have comprehensive smoke-free laws. That's what we want, because we know that works. We know that will reduce the number of smokers that we have in Kentucky, and of course it will reduce the exposure to secondhand smoke. It'll help our health, and we're for it.
For people who are interested in knowing more, you have a website, and I think we're going to put that up, and people can find information there at smokefreetomorrow.org, more about what you're trying to do with this right now.
Yeah.
You have done, as we said, some extensive polling. That's part of what your organization does. More Kentuckians think that childhood obesity is a serious problem in the state than don't. More than a third of Kentucky kids aged 10 to 12 are considered to be overweight. How do we get after that challenge?
That one's a little bit more difficult. The reason that we're trying to take on smoking to begin with, quite frankly, is that it ought to be easier. We've got a couple of solutions, which we've just talked about, at hand, which don't cost the taxpayer any money, and one of them, in fact, brings money into the state. So those ought to be easy solutions. When you start talking about obesity, you get into real serious lifestyle changes. I mean, what we've got to do, to be perfectly blunt about it, is we've got to eat better and we got to move around more. You know, it's not rocket science, but we are very sedentary. Our people and our young people don't move around as much as they should. And one of the things that we could do, of course, is to reintroduce physical education into our schools in Kentucky. To a large extent, that's gone away. Not entirely, but a lot of schools don't offer physical education anymore. We need our young people to move around more. It's that simple. And, of course, we need to eat fewer processed foods.
And your poll also says, and this was an incredible number because you almost never get to this side, 92% of Kentuckians support a law requiring a school nurse in each school building. Obviously, that would cost considerable money in a tight budget time.
Well, there's no question about that, and that's the sticking point there. I think everybody agrees that a nurse in every school ought to be something that we strive for. We're very much in favor of that as a foundation. I just got back from talking to the Nurses Association about this very subject, and of course they're very anxious to see this happen. And we believe that if you have a nurse in schools, not only does it help with emergencies, but those nurses will be able to identify potential problems at home and maybe address those problems and help young people be healthy on the front end instead of on the back end. One of the biggest problems we have in healthcare today in this country is that we have what amounts to a rescue system. We wait, our healthcare system is built in such a way that we wait till people have acute problems and then we try to fix them. And of course, at that stage, they cost a whole lot more. We spend twice as much per capita on healthcare as any other country in the world. And our outcomes rank number 37th in the world. Now, that's another intolerable situation. I don't know what really we can do about it at this point, but we ought to try, because we're spending a whole lot of money that really we don't have to spend. And the answer is trying to prevent people from getting sick to begin with, if we can. And we can do a better job of that.
With Ben Chandler, who runs the Foundation for a Healthy Kentucky. A couple more questions before we go. We'll be back in just a moment on WKYT's Kentucky Newsmakers. Welcome back to WKYT's Kentucky Newsmakers. Ben Chandler is with us. He's a former state auditor, former state attorney general, former congressman, and now he leads the Coalition for a Healthy Kentucky, an organization that he's very committed to. Beginning this summer, there will be work or volunteer requirements for Kentucky Medicaid recipients. Those who don't and who are enrolled in the program, they would be likely to lose their benefits. Do you support that?
I can tell you this, the foundation, as a general matter, very strongly believes that it's best to have more people insured rather than fewer people insured. If you can get preventive care through your insurance, the state generally, the people of the state are more likely to be healthy. So to the extent that this causes more folks to fall off the rolls, we're not in favor of that. But we want to work closely, if we can, with the governor to try to prevent that from happening. And I've been in conversation, our foundation has been in conversations with the governor and his folks about trying to arrange to see that that doesn't happen, that the people who have coverage, particularly Medicaid expansion folks who have coverage, don't fall off the rolls. And frankly, the governor's people have said they don't want that result either, because when they do fall off the rolls, like we were talking about before, it's penny wise and pound foolish. You pay more if people's conditions become acute than you do if you prevent those conditions from occurring in the first place.
And he has said that what he wants is for recipients to have skin in the game, that they have...
And I understand that. Yeah. I understand what he's trying to do. It's not going to be easy to do. That's his problem, I think, is that this is very complicated and very difficult, and people have to be monitored, and you have to set up some kind of monitoring system. But we have already reached out to the governor to try to get our foundation involved in helping to see that those folks do have skin in the game and that they don't lose their insurance. We don't want them to lose it.
Are you finished with elective politics?
Well, I have made it my business to say never, but I've got no desire to get into it at this point at all. I enjoy watching it. I enjoy being involved in the periphery. You got no idea how nice it is to not be a candidate after being a candidate for as long as I was.
Thanks for coming. We appreciate it.
Always good, Phil.
Thank you for joining us for WKYT's Kentucky Newsmakers. We'll see you bright and early on WKYT this morning. Make it a good week ahead.